As you all are aware, hepatitis C is the most common blood-borne infection in the US, with an estimated 2.4 million people living with active hepatitis C, and 40% of those living with hepatitis C unaware of their infection. Injection drug use is by far the most common risk factor for hepatitis C. Hepatitis C is associated with considerable morbidity and mortality. As you will see from the following slides, the number of hepatitis C cases continues to increase every year, despite our ability to prevent and treat hepatitis C. Next slide, please. In the following 20 minutes, I will walk you through the epidemiology of hepatitis C in the United States and the Appalachia region, hepatitis C virus infection, and substance use during pregnancy, the syndemics of hepatitis C and substance use, impact of COVID-19 on HCV services, and federal and jurisdictional response to the syndemic. Next slide. Next, please. The number of acute hepatitis C cases reported in the United States increased every year during 2012 to 2019. During 2019, a total of 4,136 acute cases were reported, corresponding to 57,500 estimated infections after adjusting for case under ascertainment and under reporting. The number of cases reported during 2019 corresponded to a 14% increase from the 3,621 cases reported during 2018. Also shown in this slide is that the increase in rate and number of reported and estimated infection occurred both in the Appalachia and in the United States. Next slide, please. During 2019, the rates of reported acute hepatitis C ranged from a high of 4.8 cases per 100,000 population to a low of 0.2 cases per 100,000 population. The horizontal line separates the Appalachia states from the rest of the United States. The vertical line indicates the national average rates of hepatitis C. In 2019, the rate of reported acute hepatitis C in the Appalachia was higher by 20% than the national rate and 33% higher than the non-Appalachia states. While the rate of hepatitis C in the US was 1.3 per 100,000 population, it was 1.6 per 100,000 population in the Appalachian states and 1.2 per 100,000 populations in the non-Appalachian states. Next slide, please. In the following couple of slides, I will show rates in the United States on the right, and rates in the Appalachia on the left. During 2019, rates of acute hepatitis C was lowest among Asian Pacific Islander persons and highest among American Indian, Alaska Native persons. However, the relatively small number of cases reported among these race ethnicity categories can result in wider fluctuations in annual rates. In 2019, rates were substantially higher among all race ethnicity categories. The most notable relative increase occurred among non-Hispanic Black persons and Hispanic persons. Next slide, please. The increase in rates of acute hepatitis C has been observed among both male and females. Compared to the rates in 2010, in 2019, acute hepatitis C rate was greater than 5 times higher for males and greater than 3 times higher for females. Next slide, please. This figure shows the incidence of acute hepatitis C among women of reproductive age. Along with the opioid epidemic, the number of reproductive age women who are infected with HCV is increasing steadily, posing the risk of mother-to-child transmission of HCV infection to their infants. Next slide, please. Rates of acute hepatitis C increased among almost all age groups above 20 years. The rate of acute hepatitis C has remained the highest among persons aged 20 to 39 years, similar to the age group at highest risk for fatal overdose. Compared with 2018, the greatest increase was observed among those aged 40 to 49, followed by those aged 30 to 39. Next slide, please. However, Looking the age data by stratifying to persons below and above 40 years of age, we notice that the incidence was much higher in those younger than 40 in the Appalachian region than that's in the United States, indicating that this is the group where higher HCV transmission is occurring and contributing to the higher incidence in the Appalachia. We didn't see such a substantial difference by race and sex. Next slide, please. Among the case reports of acute hepatitis C received by CDC, data regarding risk behavior and exposure were missing for 45% of cases. Among risk behaviors and exposure identified, injection drug use was the most commonly reported. Next, please. And next. This graph shows maternal HCV status for women giving birth in US hospitals between 2000 and 2015, stratified by opioid use history. During that time frame, the rate of maternal HCV infection increased from 87 to 217 per 1,000 deliveries with a diagnosis of opioid use disorder. Among women without opioid use disorder, rates of HCV infection increased from 0.7 to 2.6 per 1,000 deliveries. Next slide, please. Along with the increase in the incidence of HCV among women of reproductive age, data from Kentucky shows that the proportion of infants born to HCV-infected women increased 124%, while that proportion increased nationally only by 68% during the time 2011 and 2014. Next, please. And next. So of the three primary blood-borne pathogens transmitted by injection drug use, hepatitis C is the most sensitive indicator of injection drug use. Across all these studies published between 2002 and 2014, from Seattle, Washington to suburban Connecticut, prevalence of hepatitis C is always higher than prevalence of hepatitis B, which is always higher than prevalence of HIV. Next slide, please. So what's driving these increases in overdose, death, and hepatitis C infection, and what parts of the country are at highest risk? This slide illustrates an association between several indicators and county-specific rates of amount of opioids prescribed on the top right, overdose death bottom right, and reported cases of acute hepatitis C bottom right. While particularly high rates indicated in dark red in the maps occur in the Appalachia, the West, and to some extent the Northeast, every single state has seen an increase in overdose deaths rates since 2010, and the same is true for hepatitis C incidence. Next slide, please. A number of HIV outbreaks occurred after the 2015 Scott County outbreak and showed that co-infection with HCV occurred from 88 to 94% of HIV cases that were detected as part of those outbreaks. In these HIV outbreaks, HCV was detected on an average 4 to 5 years prior to the HIV diagnosis. Next slide, please. In this 2017 study, geolocation of syringe service programs, shown as black triangles, was compared with zip code of residence of young persons testing positive for hepatitis C, shown as red dots, to determine the proportion of hepatitis C infected persons who lived within 10 miles of a syringe service program. 35% of persons in the West lived within 10 miles of an SSP, but only 10% of persons in the South lived within 10 miles of an SSP. The overall range was from 0% in some Western Plains states to 77% in New Mexico, and of course 100% in Washington, DC. Next slide, please. The correlation between substance use disorder and viral hepatitis does not stop there. Since mid-2016, we're dealing with outbreaks of hepatitis A primarily among people who use drugs and people experiencing homelessness. In this unprecedented hepatitis A outbreaks, so far there have been more than 42,000 cases, greater than 26,000 hospitalizations, and over 402 deaths. These outbreaks are causing more hospitalizations and deaths than usual, primarily because some have already damaged livers from co-infections with hepatitis B and or C. Next slide, please. And next. And this slide summarizes the impact of COVID-19 on syringe service programs in the United States. The data collected by the North American Syringe Exchange Network from 174 syringe service programs from March to April 2020 indicates that SSPs were significantly impacted by COVID-19, with 43% reporting decreased services and 25% reporting that they have had one or more sites closed. Next slide, please. To assess the impact of COVID-19 on hepatitis C testing and treatment in the community, our division worked with partners to evaluate data from large testing and treatment databases. This slide illustrates the estimated average number of HCV antibody tests conducted by WIC from January 2018 through most of 2020, and found that HCV antibody testing volume decreased 59% by April of 2020. Next slide, please. And this data from a national prescription claims database also corroborates the same impact of COVID, where treatment numbers decreased dramatically over prior year without other clear indications, clear reasons. Next slide, please. However, most important in treatment is actually the access to treatment. In this study of 60 young adults with new hepatitis C infection, 49 were confirmed as RNA positive, 30 accepted referral to HCV treatment, and 5 initiated treatment. All 5 achieved cure. There remain many barriers for PWID as exemplified by this cascade of care to access treatment, which would have cured infection, reduced morbidity and mortality, and interrupted HCV transmission forward. Next slide, please. And next slide. The United States National Viral Hepatitis Strategic Plan provides the strategic direction necessary to set the nation in a meaningful course towards achieving viral hepatitis elimination. One of CDC's priorities is to support health departments to conduct core viral hepatitis surveillance and prevention activities. In May 2021, CDC launched our new integrated viral hepatitis cooperative agreement. The funding opportunity will support 59 states and local health departments to conduct enhanced viral hepatitis surveillance and develop partnership for elimination, planning, and implementation, including partners who have specialized experience and capacity to reach people who inject drugs. Additionally, 17 health departments are receiving funding to improve access to comprehensive prevention, diagnostics, and treatment services in settings serving people who inject drugs. And these jurisdictions include Kentucky and West Virginia. The next slide, please. Furthermore, driven by a common goal to help support rural people who use drugs and their communities, the Rural Opioid Initiative, which is a collaboration funded by NIDA, CDC, SAMHSA, and the Appalachian Region Commission, brings together experts, physicians, epidemiologists, and behavioral health professionals from the substance use and infectious diseases fields to build collaborations between state and local communities and conduct research to assemble locally available data and conduct research to fill local data gaps and use findings from the rapid assessment phase to propose locally relevant intervention projects and implement interventions in locations that are actually shown on this map and beyond. Next slide, please. In conclusion, HCV infection is increasing in the Appalachia as well as the rest of the United States. Injection drug use remains to be the most common risk factor. HCV infection of pregnant persons and infants born to infected mothers is steadily increasing. HCV is both preventable and curable, and there are public health measures that can be widely implemented to eliminate HCV from persons who inject drugs.